Dr. Nick Gates. I'm an orthopedic surgeon who specializes in sports medicine of the foot and ankle with Commonwealth Orthopaedic Centers in Northern Kentucky. We're going to talk about Achilles tendon problems. In my practice, I see two groups of patients who come to me with problems with their Achilles tendon. There's the classic Achilles tendon rupture, and these are typically patients in their middle ages, maybe anywhere from 25 to 55, who are still active in sports or other activities, who suffer a sudden traumatic event where they rupture or tear their Achilles tendon. These usually are patients who've not had previous problems, they've been active, and not necessarily had any previous tendonitis at all. When you rupture your Achilles tendon, that is typically a surgical problem. The standard of care for an Achilles tendon rupture is for a surgical repair of that Achilles tendon. In our hands here, we've been able to perform a repair of the Achilles tendon and move our patients into what we consider an accelerated rehab protocol. In the past, Achilles tendon repairs have been performed, followed by periods of casting and immobility and long periods on crutches. With the repair techniques that we employ today, some typical open repair techniques, and some patients who are candidates for minimally invasive techniques, we're able to accelerate that rehab and typically have patients off crutches within 2 weeks, beginning their therapy after their second week, and by week 6, even out of protective boots, protective casts, and moving on with their rehab. Our goal is to have patients able to return to their sport within 12 weeks, and this is something we can frequently accomplish, particularly with those patients who are adept and committed to their physical therapy routines. The second set of patients I see with Achilles tendon disorders are those patients who come in not with a recent tear, but with chronic pain. Chronic Achilles tendonitis is a very common disorder, both amongst the young and the old. I'll see this in patients who are athletes and runners, football players and basketball players with overuse syndromes and irritation of the Achilles tendon. But I also see it in people in their day-to-day lives have pain in their Achilles tendon. This sometimes is associated with a bone spur in the tendon. Sometimes it's just associated with degeneration of the tendon itself. In both of those cases, we have a physical therapy protocol that includes a period of rest followed by a period of rehabilitation with some specific therapy techniques that our therapy department employ to try to get the patient back to a comfortable state, whether it's their activities of daily living or even running marathons. For those patients who do not do well, if their tendinosis or tendonitis is too severe, there's a reconstruction of the Achilles tendon that we can perform, and we can also send those patients through a very similar, if not identical, accelerated rehab protocol to rehabilitate their Achilles tendon reconstruction back towards full activities. Again, this is something where we do not have to keep patients in casts for long periods of time. We're able to begin their physical therapy protocol typically by week 2 with the plans of getting them completely out of their protective casts or protective boots by week 6. Even with those patients with reconstructions, we have a protocol and a goal to get those patients back to their activities in sports within 12 weeks, but more important for many, back to their activities of daily living and back to their jobs even during the first 6 weeks after their procedure.